Hypotension, or low blood pressure, is defined as having a blood pressure reading below the normal range, typically with a systolic pressure below 90 millimeters of mercury or a diastolic pressure below 60 millimeters of mercury. While some individuals naturally have lower blood pressure without any discomfort, hypotension can sometimes signal underlying health issues. Experts suggest that hypotension may be caused by simple factors like dehydration, but it can also be a symptom of serious illnesses. Therefore, understanding the potential causes and coping strategies for hypotension is crucial. 1. Potential causes of hypotension. Dehydration. Dehydration is one of the most common causes of hypotension. When the body is low on fluids, blood volume decreases, leading to lower blood pressure. This risk is heightened during hot weather or physical activity when fluid loss is accelerated. Nutritional deficiencies. Nutritional deficiencies, particularly a lack of vitamin B12 and folate, can lead to anemia, which in turn can cause hypotension. These vitamins are essential for the production of red blood cells and proper circulation. Endocrine issues. Certain endocrine disorders, such as hypothyroidism and adrenal insufficiency, can lead to hormonal imbalances that affect blood pressure regulation. Medication side effects. Some medications, such as diuretics, antidepressants, and antihypertensives, can cause hypotension as a side effect. If hypotension occurs after starting a new medication, consult a doctor to adjust the dosage or consider an alternative. Heart problems. Heart conditions, such as heart failure and arrhythmias, can impair the heart's ability to pump blood effectively, resulting in low blood pressure. 2. Symptoms of hypotension. Common symptoms of hypotension include dizziness, fatigue, blurred vision, nausea, and pale, clammy skin. A sudden drop in blood pressure can also lead to fainting or shock. Symptoms vary from person to person. Some individuals with low blood pressure may not experience any discomfort. Dizziness and fainting. Due to low blood pressure, blood may not reach the brain efficiently, leading to dizziness and, in severe cases, fainting. Fatigue and weakness. Hypotension can cause insufficient blood flow to organs, affecting energy supply and causing fatigue and weakness. Blurred vision. Inadequate blood flow to the eyes may result in blurred vision. Nausea and vomiting. Insufficient blood flow to the digestive system may cause nausea and sometimes vomiting. Pale and clammy skin. Poor circulation can lead to pale skin, which may feel cold and clammy to the touch. 3. Coping strategies for hypotension. Coping strategies for hypotension can be divided into dietary adjustments, lifestyle changes, and medical interventions if necessary. 1. Dietary adjustments. Drink more water. Drink 2,000 to 2,400 milliliters of water daily to prevent dehydration. Electrolyte-rich beverages can also help increase blood pressure. Eat smaller, frequent meals. Avoid large meals and opt for smaller, more frequent meals to maintain stable blood sugar and blood pressure levels. Avoid highly processed carbohydrates and choose complex carbohydrates such as oats, whole grains, and barley. Maintain a balanced diet. Ensure your diet includes lean meats, fish, whole grains, vegetables, and fruits. Reduce the intake of high sugar and high fat foods, which are often low in essential nutrients and may negatively affect health. Increase vitamin B12 and folate intake. Include vitamin B12-rich foods such as fish, dairy products, and dark leafy greens rich in folate to help maintain normal blood pressure. Limit alcohol intake. Alcohol can cause dehydration, so it is advisable for those with hypotension to avoid drinking. Consume caffeine. Moderate caffeine intake can help raise blood pressure by constricting blood vessels, but avoid excessive consumption to prevent dehydration. Use herbs with caution. While some herbs like fennel and rosemary are traditionally believed to relieve hypotension symptoms, it's important to consult a doctor before using them to avoid adverse effects. 2. Lifestyle changes. Change body positions slowly. Stand up or move from a lying to a standing position slowly to prevent dizziness or fainting. Avoid crossing legs while sitting. Crossing legs can restrict blood flow. Keep feet flat on the ground and knees at hip width to maintain healthy circulation. Exercise regularly. Engage in regular physical activity, such as a 20-minute brisk walk each day, to improve circulation, but avoid strenuous exercises that could lead to injury. Wear compression stockings. Compression stockings can improve blood circulation in the lower limbs and reduce blood pooling, helping to regulate blood pressure. Avoid prolonged hot baths. Hot baths can dilate blood vessels and further lower blood pressure, so use warm water and shorten bath times. 3. Medical interventions. Seek medical attention for sudden blood pressure drops. If blood pressure suddenly drops significantly, seek medical attention immediately, as this could be a sign of a serious condition, especially for those with underlying health issues like diabetes. Adjust medications. If your current medications may be causing hypotension, consult your doctor about adjusting the dosage or switching to a different medication. Check for underlying health conditions. If blood pressure remains low despite dietary and lifestyle changes, a medical examination may be necessary to rule out other conditions such as diabetes, heart disease, or endocrine disorders. Consult a doctor about medications to raise blood pressure. Medications like fludrocortisone and midodrine may be prescribed to raise blood pressure, but these are typically used only when hypotension causes symptoms. Recognize warning signs. If low blood pressure is accompanied by other symptoms, such as dizziness, fainting, or blurred vision, and especially if blood pressure suddenly drops in someone who normally has normal or high blood pressure, it is important to seek medical attention. 4. Conclusion. While hypotension is not always a cause for concern, it can be a sign of underlying health issues when accompanied by other symptoms or when there is a sudden drop in blood pressure. By making appropriate dietary changes, adopting healthy lifestyle habits, and seeking medical advice when necessary, hypotension can be effectively managed, reducing its impact on overall health. Since individual cases vary, it is always best to consult with a healthcare professional before taking any action to ensure the most appropriate coping strategies are employed.